have somebody go check it out. We now have 7 strike forces of law enforcement officers. One is here in LA because we've seen, unfortunately, a spike in fraudulent activity here, but we have a kind of combined strike force. So we've got some new resources, and already those efforts are paying off. Just in the last 10 months, we've charged 465 defendants with defrauding Medicare of almost $1 billion. And over the last year, we prosecuted and returned about $2.5 billion to the trust fund. So the signal is pretty clear. The Affordable Care Act also increased criminal penalties, increased civil penalties, gave us some ability to actually stop claims that we expect to be fraudulent before the money goes out the door. I don't know how many of you have ever had a call from your credit card company when they see a strange bill and they say, you know, Mrs. Smith, we just got a bill from Saudi Arabia using your card. Were you recently in Saudi Arabia? And if the answer is no, the money never gets paid, and they go after the fraud. We're building a system to do exactly the same thing. So we no longer will pay what we suspect to be fraudulent claims. We'll have an ability to check it out first and then save that money. So hopefully we can be more vigilant. We also have this great army on the ground, the Senior Medicare Patrol, and Joyce Rosenthal, who's with us today, is one of those volunteers, and they're all over the country. The President has also asked us to double the number of SMP volunteers who work under our Agency for Aging, go through a special training program, but then work with friends and neighbors about how to protect themselves against fraud, what to look for, how to read bills, where to report fraudulent activities. And we think that the best activity is not really the law enforcement officers, but the beneficiaries themselves, to be aware and alert, to know that giving a Medicare number to anyone over the phone or all over the internet is very dangerous. That is a very valuable piece of information. It can then be used to access a system. And I think too often people are trusting of folks who really are not so trustworthy, and so can open the door to fraudulent activity. But we're very interested in these conversations and hearing from all of you. I'm going to introduce you to Joyce and let her speak for a little bit, and then I'd be happy if we have some questions and time for conversation to come back and answer questions. So, Joyce Rosenthal.
Thank you, Madam Secretary. I do work as an SMP, Senior Medicare Patrol volunteer. There are 2 parts to the work I do. When I wear my paralegal hat, I am doing summary of cases that the attorney has given me, and she uses these summaries as one of the tools to let her know how to proceed, because most of the time what we get is a bunch of documents, and I try to make sense out of them, and she takes it from there. My other hat is as a data specialist, and I enter all kinds of facts about volunteers who work and help to make sure that Medicare fraud is abated. What I enter into a special computer program are places that these talks have taken place, the number of hours that have been spent, the specific population that is talked to, and this combined into a report lets us know how we're doing in keeping up with keeping Medicare fraud down. Now, in terms of actually keeping Medicare fraud down, as you heard the Secretary say, the sacred sentence is never, never, never give out your Medicare number to a stranger. That is very important. But what's also important is the first line of defense is you. You have to become your own advocate. You have to pay attention to what's happening in your life. Collect your medical bills. Collect your Medicare summary notices. Those awful papers that you think you can never make sense of. I understand they're going to change them. But in the meantime, you really have to learn how to read them. I learned how to read them. You can learn how to read them. And what do you look for on your Medicare summary notice? Do you recognize the doctor's name? Beyond that, what about the service that the doctor billed you for? It may be your doctor, it may be the service that you had, but you only had one treatment and you've got 2 and 3 items on there. All of that can be considered and suspected of Medicare fraud. And what you need to do is, if you suspect it, you have to report it. Unless we know about it, we cannot do anything about it. You can talk to your medical provider, or you can call your local SMP group. The other part is also examine your explanation of benefits for your drugs. Did you actually receive the drug that you were billed for? If it's yes, fine. If it's no, again, suspected fraud and report it. There are other times when you can help yourself too. You get telephone calls. Wonderful opportunity. You can switch your plan. We'll do all the paperwork for you. All we need is your Medicare number. All you have to do is say, excuse me, I'd like a little time to think about this. Can you send me some written papers that I can review? And will you call me back in a couple of days? And if they call you back, at least you've had time to look at it. If they never call you back, wonderful. You've escaped Medicare fraud. The same thing with meeting people. You go to a luncheon, special luncheon. People are there, they're nice people. They want to help you. All they need is your Medicare number. It's okay to say, I need some time to think about this. Can you call me back in a couple of days? Same thing. If they call you back, you've had time. If they don't call you back, congratulations. You won't be a victim of Medicare fraud. Finally, what I'd like to say is we're always looking for new volunteers. That's the lifeblood of our organization. And if you decide to become a volunteer, you get training, you get a wonderful senior Medicare patrol book. It's written in English that you can understand. No government legalese. And eventually you can go out and talk to people, help people, explain, because you've been there, explain that. So if you're interested, you can talk to me afterwards, secretary, but it would be very nice if we saw some of you as volunteers. Thank you for letting me speak to you today.
Now we have an opportunity to hear from you. And what we'd like to do is have, if you've got questions, the secretaries would be happy to answer these questions. Before we start, I just wanted to say a quick thank you to Susan and Laura and some of the other staff who really put all this together. Thank you for really pulling this all together for all of us. So now, questions?
Yes, ma'am.
I'm Louise Layla, and I have 2 questions. But I want to begin to thank you for taking time to visit our center and to give us the opportunity to voice our concerns. My first question is, with these budget cuts, will the seniors center services be curtailed? Now,
You're talking about California budget cuts?
Yes.
I may have to have Paul answer that because I really don't.
I don't know whether the cuts would come from the federal or from the local.
We're talking about the potentials coming from the state.
Yeah.
And at this point, we don't know what the outcome of those conversations will be, but we're hopeful that it won't be, that the center will continue to go.
The federal government is not cutting senior services and is not cutting funds that will come to senior centers. So if it's cutting, it's got to be at the state level.
Now, my second question is, with this new health care regulations, will the budget for Medicare, Medicaid, or even our independent supplementary insurance, will they be affected? Because at the moment, many doctors are not taking new Medicare patients, or Medicaid for that matter, because of the low payment of the Medicare payments. So if we get more cuts, I don't know what's going to happen to that. Thank you.
Well, that's a great question, and I know that doctors are very concerned, and we have worked with physicians across the country. First of all, the American Medical Association and the American Pediatric Association and the National Physician